Okay. Hi, my name is Elissa Hammond, and I'm going to be performing my sterile gloving checkoff. First, I'm going to list my 12 safety precautions or procedures. One, I would verify the care and order for the client. Next, I would perform hand hygiene before and after performing client care or handling any supplies. Next, I would verify the facility's policy and procedures and assemble the appropriate equipment and supplies. Next, I would consult with the manufacturer's recommendations when assembling any equipment that's involved. Next, I would knock on the client's door. I would identify the client with 2 identifiers, 2 being their name and date of birth. Next, I would note the overall condition of the client. Then I would explain the procedure with the client and provide for privacy. Next, I would then raise the bed for good body mechanics. I would don my PPE if indicated. Upon completion, I would lower the bed. I would apply the handrails, how it was indicated on the client's care plan, and then I would place the call system or call light within reach. Next, I would then report to the charge nurse if there was any abnormalities indicated or found, and report it to the charge nurse immediately. Okay, just small space to work with. Okay, I would then take my solution, not reaching over sterile area. I would take my solution, label to my palm. I would pour it on my sterile area. I would then discard of this. I would then take my gauze sponges, open it, place them. Nothing of the plastic or any of this would touch my sterile area. I would then discard of this. At no point in time will my back be turned to any of my environment. That would be this area. I would not touch within my sterile spot. I would have to stay within a 1-inch perimeter, which is not sterile because I'm not sterile. For the sake of this video, I will have to move this area. Any other time, I would not touch any of this. Now for my glove portion, after I had finished assembling my sterile environment, I would then place on my sterile gloves. Again, staying within the 1-inch perimeter of my gloving. Okay, so starting with my dominant hand, I'm going to use my 2 fingers and my thumb. I'm going to pinch the opening of the glove and place it onto my dominant hand. My dominant hand is now sterile. I will then take my 3 fingers into my non-dominant hand glove inside the sterile area, because sterile will touch sterile, non-sterile touches non-sterile. Hold on. Hold on. Go with Sissy real quick. I would then place my glove in. Or my glove on, not in. Place my hand in my glove. Now hands are sterile. Sterile can only touch sterile, so when discarding my trash here, I would have to touch inside because that is sterile. I would then turn this, I would grab this, discard it. And then I am ready. And check off complete.